I think one of those reasons links back to what members of the public said to us in some of our earliest engagement, and that was is that they couldn't engage with the standards particularly well. They found them too dense and too technical, and they didn't understand why our standards supported public protection. In a lot of cases as well, members of the public were thinking about the quality of services that they might receive. So those aren't things that our standards are actually necessarily intended to influence, but rather the quality of their experience of the regulatory or registration system if something goes wrong and that they need to engage with it. So part of the work that we've done has been around making sure that the purpose of the standards is clear, and that's to as wide a range of audiences as possible, remembering that members of the public come from a wide variety of backgrounds and that engaging with the complexity of some of the things that we think about in regulation and registration isn't something that they should be expected to do. So a big key set of changes we've made has been around clarity, accessibility. Another thing that we were really keen on making sure we were able to achieve through the standards review process was making sure that the assurances that we provide for regulators and registers, which were already very, very similar, were at the level of the standards presented as similarly as possible as well. So the models of regulation and registration are more similar than I think many people understand. And the things that we expect of an accredited register are broadly the same as the things that we expect from a statutory regulator. But the way in which those outcomes are achieved may vary. So we've, in some cases, leveled up the standards so that they make sense in that context. So where we might have talked about prosecution of protection of title offences in one set of standards, and we previously were talking about our trademark for the quality mark in the other set of standards for accredited registers, we now talk about the outcome of trying to prevent members of the public being misled in relation to somebody's status on a register, whether it be statutory or an accredited register. And that sense that the two sets of standards are now the same, I think has a really important impact on how members of the public are able to understand what they should expect, and also in helping employers and commissioning bodies make the best use of the accredited registers programme. Another area of particular focus we've had, and we've had this for quite some time as the Professional Standards Authority, is focusing down on checks for professional suitability, when and how they occur, and what's the most proportionate means for that to happen, given the wide variety of ways in which practitioners on regulators and registers all practice. So we've got people who are working in full-time employment and they're subject to regular professional suitability consideration, which includes criminal records checks on a periodic basis. And then we also have people who are working in purely self-employed private sector settings. And depending on which country of the UK you're in, members of the public might have difficulty in accessing information about professional suitability, and practitioners might have difficulty in trying to request certain types of criminal records checks as well, because they don't fall into certain categories. Now, we were conscious while we were doing this work that the UK government was planning on making changes in England and Wales to the legislation in this space. And we're now seeing those changes start to come into force or to be legislated for. So a really thoughtful way that we've tried to engage with the requirements in this space is to use the right principles. And that's to make sure that we're taking a proportionate view and a risk-based view on what the right level of checks are. Now, we don't think that we should make that decision in the first instance, but rather that should be a judgment for regulators and accredited registers. But then our role as the oversight body is then to test that thinking and make sure that members of the public are adequately protected through the way in which the scheme works at a particular register. So that might mean that for professionals or practitioners who are working in employed settings, subject to regular checks that happen as a part of that, that declarations could be sufficient to make sure that somebody is reporting the fact that changes to their professional suitability could have a bearing on their registration, because there are other mechanisms for that to be reported as well, whether that's to an employer talking to a register or a regulator, or whether that's to a commissioning body, or whether that's because of the fact that the offence is notified through the police if it's particularly serious. Whereas in other settings, it might be inappropriate for that level of trust to be placed on a practitioner, and actually that the regulator or register might need to see the evidence on a periodic basis. And we think that there's going to be significant variation within professions, and that means that one of the most important changes we've made there is that we're expecting regulators and registers to understand where it is that people are working, how they are working, and what professional suitability checks may surround them, so that it can take a risk-based approach as well. And then we'll be testing that through our assessment processes. We've also made some changes that affect the accredited registers a little bit less than they affect the statutory regulators, because we've for a long while now had a governance standard in relation to the accredited registers. But we have made some changes to that standard, and we've also brought it consistently across both regulators and registers now. And in that governance standard, we're focusing in on what the governing body does in order to assure itself that the organisation is functioning well. And that covers quite a wide range of things. So that's good decision making. That's how, if there is one, a staff body is engaged with, and what it feels like to work in that organisation. And we think that that's a really important part of the work that we've done here, because of the fact that we know that organisational culture can shape the outcomes at complaints processes. So if we want to make sure that complaints processes are robust, then we also need to make sure that the governing body is playing its part in overseeing how the organisation makes its decisions, how the people in the organisation are working with one another in order to make good and safe complaints decisions. And also just generally the decisions that are required to protect the public, to have that learning culture so that it's possible to say, we could have done better here, and that we're going to make a change to how we work to prevent this issue from happening. We've also made changes that relate to how the standards that we oversee for practitioners work, and we now have a clearer expectation, though this was in our standards before, that standards will be evidence-based and up to date. What we think this means is that we're able to just put a little bit of challenge within the context of our role being an oversight body without the professional expertise necessarily in our staff body in relation to professional practice, to ask questions about, well, where is the most recent evidence in relation to where you're setting this standard? And if there is a piece of national guidance that exists, why does your guidance or standard sit apart from that? And that's not to say that we will always make the judgment that all standards must follow national guidance, because of the fact that we see variation in national guidance, and the standards need to reflect that. But it's more so that we can be a part of the process of testing the rationale and really thinking through whether or not the standards frameworks are effective at protecting the public by being evidence informed and up to date as well. I think probably the biggest thing that I would say that is likely to arise from the work that we've done on the standards is that we are going to be developing new and better evidence around how it is that regulators and registers are working in a more granular way, particularly for the accredited registers. And what we hope that that will mean is that we're going to be better able to support and encourage improvement by sharing good practice. And that's something that we've tried to do before, but we just haven't had a really strong data set that's kind of framed around that purpose through the design of the standards themselves. And that's something that we'll be introducing with this round of changes that I'm particularly excited about, because I think our role is dual here. It's to assure compliance from regulators and registers, but it's also to be the thing that drives improvement within the sector as well, and making sure that we've got complaints processes that are working well, that we've got standards that protect the public, and that we're making the right decisions about who and who should not be on registers for health and social care practitioners.